Most of us have a deeply ingrained habit when we step out of the shower. We grab a cotton swab and try to scrub our ear canals entirely clean. This urge is incredibly common. In the United States alone, the accumulation of earwax leads to 12 million patient visits and 8 million medical removal procedures every single year. But from a biological perspective, cerumen, what we commonly call earwax, is actually a highly engineered hydrophobic shield. It's a precisely calibrated mixture. Secretions from specialized glands blend with dead skin cells and normal bacteria to coat the ear canal. This mixture protects the delicate skin inside from water damage and infections. We spend enormous amounts of time and energy trying to eradicate a substance perfectly designed to protect us. To understand why this substance sometimes traps us in painful medical impactions, we have to look at how the ear actually cleans itself. The external auditory canal is a dynamic mechanical system. In this diagram, the canal has two zones, an outer cartilaginous third and an inner bony two-thirds. In the outer section's inset box, sebaceous and ceruminous glands act as a manufacturing plant, secreting the raw materials for cerumen. Once wax is produced, the ear relies on a process called lateral epithelial migration. The skin cells actually grow outward from the eardrum, sliding along the canal walls in a single continuous direction. Every time you speak or chew, your jaw movement assists this migration. The ear literally sweeps itself clean, carrying debris outward on a biological conveyor belt without requiring any outside intervention. The system has one major structural vulnerability. Looking closely at the diagram again, right where the cartilage meets the bone, the canal narrows. This choke point is called the isthmus. As we age, the glands in the ear canal begin to atrophy. They produce a harder, drier cerumen that migrates much more slowly and struggles to pass through the isthmus. But the primary reason this self-cleaning system fails is human interference. Items like hearing aids or in-ear headphones, and especially cotton swabs, present a massive obstacle to this delicate mechanism. When you insert a cotton swab, you defeat the conveyor belt. The swab acts like a plunger, forcing the cerumen backwards against the natural flow of the skin and packing it tightly past that narrow isthmus into the inner bony canal. Once wax is lodged medial to the isthmus, it dries into a rock-hard impaction. This leads to distinct clinical symptoms: hearing loss, a feeling of fullness in the ear, ringing called tinnitus, and occasionally even a reflex cough. By trying to blindly and manually scoop out the wax, we completely break the body's natural disposal mechanism and actively create the kind of severe obstruction that requires clinical intervention. The official clinical guideline for managing earwax is remarkably simple. If you have wax buildup but no symptoms, you do nothing. You let the biological machinery handle it. When an impaction does cause symptoms, doctors follow a strict three-tiered escalation strategy. The first tier is chemical. Clinicians recommend applying over-the-counter cerumenolytics, like carbamide peroxide drops, twice a day for up to 4 days to soften the obstruction. By liquefying the rock-hard mass, this chemical treatment often allows the ear's natural conveyor belt to regain its traction and push the remaining debris out on its own. If the wax remains stuck, doctors move to Tier 2, kinetic intervention. This involves irrigating the ear canal with warm water, often treated with a bacteriostatic agent to prevent infection. This medical illustration of an irrigation procedure shows the exact physical technique required. The syringe directs the stream of water up against the roof of the canal, flowing behind the wax to flush it outward, rather than blasting it head-on. For the most stubborn impactions, or for patients with damaged eardrums, doctors use Tier 3, manual extraction. Otolaryngologists use binocular microscopes, lighted curettes, and targeted suction to carefully pull the wax free. Every single evidence-based medical procedure focuses on safely bypassing or assisting the ear's natural mechanics. This is the exact opposite of digging blindly into the canal. This brings us to the alternative home remedies you should explicitly avoid, most notably ear candling. The FDA has issued strict warnings against placing a hollow, lit candle in your ear. The procedure has zero proven efficacy for removing wax, but carries a high risk of burning your face and permanently damaging your ear canal. For individuals prone to recurrent, symptomatic impactions, clinical guidelines offer a much safer preventative habit. Once a week, dip a cotton ball in plain mineral oil and place it gently in the outer ear for 10 to 20 minutes. The mineral oil safely soaks into the cerumen to keep it soft and fluid, all without applying any mechanical force that could disrupt the skin's outward migration. Maintaining healthy ears requires trusting thousands of years of evolutionary engineering. If the system needs help, soften the wax gently, but step away from the cotton swabs for good.